Okay, welcome everyone to your hospital, Zahra. We'll start with erectile dysfunction and we'll stress on the first line treatment, PDE5 inhibitors. How important is sex in your overall life? This question was for a certain population. It was 83% for males and 63% for females. Why ED is important? Because it affects my relationship, and it relieves me, and I am embarrassed if the erection failed. Patients are reluctant to talk to their doctors about ED. 71% believe ED would not be recognized as a medical problem. Others fear that discussing sexuality may embarrass their doctors. Our role as a physicians is to understand the importance of taking sexual history. Physicians and medical students find it difficult to obtain a sexual history. What to do? We have to do training courses on treating ED, tutorials, interactive sessions, and focus on physician communication skills with the ED patient. We should promote patient-centered approach and avoid maintaining judgmental attitude toward patient sexual practices. And above all, increase the public awareness. As we all know, there are major risk factors for ED, which are mainly chronic diseases, such as diabetes, prostate disease, peripheral vascular disease, cardiac problems, hyperlipidemia, hypertension, and even depression. They are all components of a metabolic syndrome. As you can see here, the comorbidities with erectile dysfunction also, with diabetes and with age, it increases. Also, there is, as we all know now, there is a strong association between ED and BPH lots. From 20 to 30% in men in their 50s to between 30 to 60% in men in their 70s. The increased the prevalence of lots in men with ED. You can see this in this graph. A number of pathophysiological mechanisms, the most theory till now is related to the nitric oxide and cyclic GMP signaling pathway has been implicated. ED is sometimes, I'm not saying it's always, but it sometimes could be an early sign of cardiovascular disease and endothelial dysfunction. To restore an erection is not in itself all that men and their couples may need. We should always remember that it is associated with serious treatable disorders. 68% of men with hypertension have ED. 60% of men with ED have dyslipidemia. 56% with ED have a positive stress test. 40% of men with ED have a significant coronary occlusions. 20% of men with ED have diabetes mellitus and 11% have depression. Erectile dysfunction is a marker of coronary artery disease. This is true for older patients above 60. This is also true for younger patients below 45. Age is irrelevant. Incidence of coronary artery disease with respect to age and erectile dysfunction. And as I remember a few years ago, there was a certain course in AUA that was presented by a cardiologist that predicts a coronary artery disease in the coming 18 months after ED. In London, EU 2017, the Europeans said it's more probably in the coming 10 years. ED and diabetes mellitus, prevalence of ED among diabetic patients, 35% to 90%. and similar likelihood whether it was diabetes type 1 or 2. Also, it's connected to hypertension. Study involving 104 hypertensive patients, the mean age 62 years. 68.3% had various degrees of ED. Severity of ED also noted to be more. 45% versus 11 with severe ED. The hypertension is by itself associated with ED, and the drugs we use to control hypertension sometimes, such as diuretics or beta blockers or alpha blockers or ACE, may affect the ED. Also, the dyslipidemia has considerable impact on the erectile function. ED and depression. ED reduces the desire for basic intimacy. ED and testosterone deficiency might be linked to cardiovascular disease and metabolic syndrome, also for the diabetes mellitus and insulin resistance. There was a study of 134 men in Korea with serum testosterone less than 3.5 and sexual dysfunction. It revealed that total testosterone significantly associated with IEF's total score. As we previously said, it's associated most of the time with the metabolic syndrome, central obesity and impaired glucose intolerance, raised blood pressure, and dyslipidemia. It might not be easy to identify the needs to be actively looked for. All right. WHO treatment recommendation. First, lifestyle modification, stop smoking, limit or avoid alcohol, follow healthy diet, exercise, reduce weight, and get adequate sleep. Drug therapy modifications. We can modify the drugs sometimes. Psychological or psychosocial counseling. Androgen replacement. And we can use oral PDE5 inhibitors. Tadalafil. As you can see here in the EU guidelines, the managing of ED, we all know, I will skip it. Summary, there is a close link between ED and LUTS BPH that cannot be explained by age alone. There are a number of pathophysiological mechanisms that link ED and LUTS BPH, and currently available medical therapy for LUTS BPH have adverse effects upon sexual function. In conclusion, tadalafil is the first effective agent for the treatment of male LUTS in those men with coexistent erectile dysfunction. Early treatment of nerve-sparing radical prostatectomy patients with tadalafil restore erectile function is more in more patients than placebo. Only 10 to 28% of all ED patients are being treated. Males epidemiologic study shows that 58% of ED men actively sought treatment, but only 16 continued the use of oral drugs. As you can see here, the ED treatment, the lifestyle, the oral agents including PDE5, the devices and injectable agents, and sometimes the surgical options. Sometimes there is no response for the treatment. The reasons for acute or delayed failure include severe erectile dysfunction at presentation and the worsening of endothelial dysfunction and progression of penile atherosclerosis, and sometimes after surgeries, after radicals. Unrecognized hypogonadism, inadequate patient education, and incorrect drug usage. And sometimes the development of tachyphylaxis, which is drug tolerance. Because of that, sometimes we switch from sildenafil to tadalafil, and vice versa. Psychosocial factors. Referral. A busy primary doctor may decide to refer patients with erectile dysfunction that does not respond to PDE5 inhibitors to a urologist, andrology, and sexual health specialist, or other specialists. Although no study directly compares the efficacy of the 3 PDE5 inhibitors, the efficacy and tolerability are probably similar for the 3 drugs. Most patients will try another PDE5 inhibitor before they consider more invasive options. We'll speak a little about the Herox. It's, as we said, the most common etiology of male LUTS is BPH, but it's not BPH alone. 48% of all men reporting routinely to a GP have enlarged prostate based on DRE. The erectile dysfunction, as we also said, is associated, strongly associated with age and LUTS severity. Real-world safety and effectiveness of tadalafil in patients with lower urinary tract symptoms secondary to a benign prostatic hyperplasia. This was a Japanese post-marketing surveillance study that concluded and demonstrated that tadalafil has a favorable safety and effectiveness profiles for a long-term use in Japanese men with lower urinary tract symptoms secondary to benign prostatic hyperplasia. Tadalafil alone or in combination with tamsulosin for the management of LUTS. We use it sometimes, although the guidelines are not okay for now, but we can switch between them. Tadalafil should be considered a primary treatment options for patients with LUTS, BPH, and ED. Evidence highlight on the excellent tolerability, safety, and effectiveness profile, both alone or in combination with tamsu. Tadalafil once daily or PRN showed efficacy in patients with ED. As we can see in the guidelines, phosphodiesterase inhibitors reduce moderate to severe LUTS in men with or without erectile dysfunction. And only tadalafil has been licensed for the treatment of male LUTS in Europe. Herox has the same bioequivalence to the originator. It significantly improves BPH LUTS, and there is a remarkable improvement in combination therapy with tamsu, alternative to on-demand ED treatment in men with diabetes. And it also improves erectile dysfunction with significant improvement. Favorable safety and effectiveness profile on long-term use. Thank you.